In. Hi, Miss Smith. Hello. Okay, so we are going to take a look at how things are going from a physical point of view. If you have any questions as we move through the assessment, just let me know. Okay. So I'm going to start by taking a set of vital signs. Okay. Take your blood pressure and your pulse and your temperature. And then we'll do a breast assessment, and then we'll assess your abdomen. Okay, great. Okay? Oh, okay, you can actually put your hand right over here. I'm going to start by getting your baseline. About 110. I'm going to go up to about 140. Ugh. You're at 100/50. Is that consistent with what it has been in the past?
Yeah.
Yeah? I'm just going to take your pulse and just comfortably. So your pulse is 96 and your respiratory rate is 14. That's all normal. We're gonna just take your temperature. Have you had anything cold or warm to drink recently? Okay. Underneath your tongue. I've done this before. Good. 36.9. Everything looks good. Okay, so we'll get you to lie back down.
Okay.
We'll do a breast assessment, and then we'll look at your abdomen.
Great.
Pause. I'm going to get you to maybe just sit back.
Okay.
So that we can take a look again. I'll be writing things down, and I'll also be verbalizing what I'm looking for as I go.
Okay.
That way you can learn and you can ask, but you can be prompted to ask questions
Right.
as well. So I'm just going to start by looking a little bit at your skin. Have you had any rashes or any issues with regard to your skin? There's a little
No,
rash there.
so that's from my vacation.
Okay.
Just a
Are you
little heat rash.
sun sensitive?
I am on my hands very much so.
Okay. Okay.
Other than that, no, I had a rash on my belly early on in my pregnancy, which subsided just sort of spontaneously on
Okay.
its own, and nothing since.
Okay.
So,
Good. Okay. Do you have any skin tags?
no,
Shoulders?
none that
No,
I've
not on your
noticed.
chest or on your neck?
No, nothing
Okay.
that I've noticed.
I noticed you have a little bit of what we would call melasma or cloasma, depending on. And so that is just some hyperpigmentation on your
Yes.
face. Is that from your vacation or is that from pregnancy?
I don't know.
Okay.
Maybe a little bit of both.
Okay.
But it's something
Could
that
be.
could happen during pregnancy?
Absolutely,
Okay.
and it typically goes away within the first, I'm going to say year
Okay.
after pregnancy, so it will just slowly kind of disappear.
Great. Okay.
I'm going to expose, are you okay if I expose the rest of you? So I'll have to just take a look at this and tie it up. Okay. Okay, so I'm going to start by here. I'll just have you go down. I see that you're wearing your tights, which is
Yes.
great. So I'm going to start by just going up this way.
Okay.
I'm gonna just look at your abdomen.
Yep.
Just look at the skin. And I'm going to look at your legs as well.
Okay, no problem.
Okay, so we'll just expose what we need to. Okay, you're okay if I
Yeah,
just
go
open
ahead.
this up? Okay. Good. So no more rash on your abdomen
No.
at all?
It's
Okay.
gone, yeah.
And I see that you don't have any linea nigra, which is something that sometimes happens in pregnancy where you get
Okay.
sort of dark pigmentation. Did you get that during your first pregnancy?
No,
Okay.
nothing. And
Okay.
no stretch marks.
No stretch marks. Yeah, very nice.
So,
that is a
fingers
concern that
crossed.
many.
Yeah.
Okay.
I'm trying to keep it nice and moist, like moisturize. I don't know if that helps for stretch marks, but it seems to be working.
Yeah, I think the jury is still out on that. I'll re-expose your abdomen afterwards
Okay.
since we're going to take a look at, but I'll just do
Okay.
one step at a time.
Yep.
Yeah, it's a bit controversial whether or not it actually does anything in terms
Okay.
of moisturizing and oils and that sort of thing, but certainly the companies will say so. It's difficult to know though, but there's no harm in in moisturizing. Do you have you had any pain in your calves?
No, some leg cramps though.
Okay, I'm just gonna push back. Any pain there?
No.
No. Okay.
At
And any
night.
swelling? See, you don't really have any swelling.
Not too bad, but on my vacation after the long flight, yeah, or like
Mhm.
when I was on my
Okay.
feet all day, I noticed a bit of swelling. Yeah.
Okay, and that's very normal within pregnancy as long as there's not other stuff going on. Okay. Good. Do you have any problems with your gums? So any bleeding? Because sometimes we can. Do you mind if I just take a quick
Yeah.
look? I just touched your feet. I'm gonna re-wash my hands. You can. Yeah. Okay.
Sometimes when I brush,
Yeah.
they can be sensitive and bleed. And I've noticed, but this was before pregnancy, like just some of them on this side are starting to reside.
Okay.
So
And that was even before pregnancy.
that was even before
Okay.
pregnancy.
And the bleeding is more than
just a
than before.
slightly more, but nothing, nothing crazy.
Okay. Do you use a soft bristle toothbrush?
I do.
Okay.
Yes.
You might even go to ultra soft.
Okay.
Yeah, just to prevent that bleeding because you will have just a swelling of the gums. It's a normal part of pregnancy.
Okay.
Any cankers or any type of ulcers in your mouth?
No. Sometimes from time to time I do get, but nothing.
Predates pregnancy as well.
Yes,
Like you've
yeah.
had it before. Okay. Okay. That's
Yeah.
fine. Good. I'm just going to assess your. Here we are. I'm just going to take a look at your neck. Any pain? Any swollen lymph nodes? No swelling in your thyroid. You've never had any thyroid issues that you didn't mention them before?
No.
Okay. Good. I'm going to listen to your heart and lungs, and then I'll assess your breasts.
Okay.
And I'm going to also take a measurement of your what we call fundal height, so a measurement of your abdomen to see that your baby's
Okay.
growing according to expectations. When's your next ultrasound?
I'm in about 2-3 weeks.
Okay. Okay, so now I'm just going to listen to your heart. During pregnancies, there's increased blood flow, about
Okay.
50% increase in blood flow. And so that can cause some changes to what we hear on auscultation when we listen to your heart. There can be an arrhythmia, there can be a murmur. Murmur is usually associated with that increased blood flow.
Okay.
Those, if they're identified, then I would speak to your primary care provider to do a full assessment to make sure that it is considered non-pathological, so normal during pregnancy.
Okay.
So we would need to validate that. So I'm just going to listen with both the diaphragm. I'll start with the diaphragm just to listen to your heart rate and for any arrhythmias. Just going to listen on Herb's point. I would normally do it directly over the skin. Okay. And now I'm going to listen with the diaphragm for murmurs. Good. Regular rhythm, no murmurs. Great. So things are looking good. Okay. So I'm just going to assess your breast. Can you tell me, have you had any breast changes during this pregnancy?
Nothing major that I've noticed, no.
Okay. Any darkening of your areola?
A little bit.
Okay.
Which I've had in the first pregnancy, and I was told it was normal, so.
Okay. And any little spots as well on your areola? I already see that you have a few little spots.
A little bit.
Yeah, okay. Those are called Montgomery glands, totally normal.
Okay.
They secrete a little bit of a substance that keeps your nipple soft and supple, and it's intended to facilitate breastfeeding, actually.
Okay. And I do notice that they've been leaking a little bit, which is normal?
Yes, yes
Okay.
it is. Yeah, it is normal.
Okay, good to know.
A certain about 50% of women will experience that in the latter half of their second trimester. So,
Okay.
yeah. Do you mind if I touch?
No
So
problem.
I'm just going to touch just to feel for any type of tenderness. Do you have any pain?
No.
Yeah. Are they larger than they were before pregnancy?
They are, yes.
Okay. Your child is how old by then?
3.5.
3.5? Okay. Until when did you breastfeed her?
I breastfed her exclusively for the first 5 months, almost 6.
Okay.
And then I continued for about a year.
Okay, so it's been a couple years since you've not breastfed.
Yes, exactly.
Okay. And you did notice an enlargement since the beginning of your pregnancy.
Yes.
Okay, great. Good. I'm going to now just expose your abdomen. We're going to take a look to see. We already looked for the pigmentation and all of that. I want to just take a measurement. So we're going to take, I see that, again, your skin looks lovely. There's no rashes or stretch marks or anything. I'm going to take the height. It should, at this gestational age, the height in centimeters should correspond to approximately, give or take 1 centimeter, to your gestational age.
Okay.
Okay, so you've had this measurement before?
Yes.
Okay.
One.
Yeah. So we go from the top of the symphysis pubis to the top of the fundus. We're at 27. Any pain, any tenderness?
No.
Okay, 27 centimeters. You're right there. Perfect. Excellent.
Thank you.
Good. So if there are no other concerns, normally we would listen to the fetal heart. I don't have a daptone, so that'll be done at your next appointment.
Okay, great.
And then you'll be going for a subsequent ultrasound. Do you have any questions before I leave you to get dressed?
No, I don't think so.
Okay.
Thank you very much.
Great. So when you're done, I'll come back in just 2 minutes and we'll just wrap things up.
Great.
Okay, thanks.
Thank you.